All right, good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. And we work with a variety of neurological conditions from a natural perspective, one of which is Meniere's disease. And I've talked about Meniere's disease for years relative to associations with Hashimoto's Thyroiditis and autoimmunity. And in today's broadcast, I'm going to try and bring it together so that you have some research articles to look at, as well as some of the newest imaging modalities, and really helping to diagnose a Meniere's case and substantiate if you have Meniere's disease versus something like vestibular migraines. So that's what we're talking about today. So MRI imaging has been looked at for this issue since about 2008. There are about 39 articles on this topic. And this was the first, actually this is not the first one. I believe this is the first article that I found looking at that relationship. Now, they talk a lot about using 3 Tesla MRIs. In your bigger cities, 3 Tesla MRIs are more common. In your smaller cities, 1.5 Tesla MRIs are more common. And the 3 Tesla MRI is just simply more powerful, and it can really look at structures in the brain and the inner ear with a greater degree of certainty, if you want to say it that way, and acuity. So 3 Tesla MRI was starting to be investigated in around 2008, looking at the inner ear of Meniere's patients to see if there was or was not damage. And this is the first article. But I'm going to go back up and talk about this a little bit more. And the reason why this is important is because Meniere's disease does overlap with vestibular migraine in terms of the symptomatology. So what are vestibular migraines? Vestibular migraines are patients who have a history of migraines. They may or may not have migraines now, but they have moderate or severe headaches associated with episodic vertigo, which can be the room spinning around them, where they may feel like they're rocking or bobbing. And they actually can, I didn't cite this article in this presentation, but it has been documented that they can have low tone sensory neural hearing loss, very similar to Meniere's disease. So that's important too, because the two can really overlap. So probably backing up, what is Meniere's disease? Most of you watching this probably know, but Meniere's disease is a condition where the inner ear, for all intents and purposes, we think that it swells in terms of fluid pressure. As that fluid builds, individuals are likely to have tinnitus, ringing in the ear, pressure in the ear, episodes of vertigo lasting more than 20 minutes. And when you see your ear, nose, and throat specialist, either they will refer you to an audiologist who's going to diagnose you as having possibly sensory neural hearing loss on one or more occasions. And then you may also have video nystagmography done, where they put the goggles on you and they inject warm and cold air into your ears and do a bunch of eye movement tests, and they may see that your inner ear has a paresis on one side of about 25% or more. All of these are the signs and symptoms that lead a doctor to then say, okay, it looks like you have Meniere's disease. Diagnosis in the world of dizziness and vertigo is super important because a lot of the conditions overlap. And dizziness can be kind of a nebulous finding where somebody just feels like they're floating, but vertigo is where the room is literally spinning around someone for a long period of time, and it's awful. That's Meniere's disease. But what's coming out in the literature, and there's a lot of discussion about this, particularly since vestibular migraines are a relatively new diagnosis, and the main otological societies, so to speak, those are your researchers really focused on the inner ear, are saying that vestibular migraines are way underdiagnosed, that they're much more common than we previously thought. And there are researchers arguing that a lot of Meniere's patients actually have vestibular migraines. So I'm going to try and talk about ways, if you have looked into this, ways to differentiate these aspects, as well as if you are suffering with Meniere's, other natural solutions or factors that you may want to have tested for to help your condition. Because we all know the standard course of a Meniere's patient is basically you go to the ear, nose, and throat doctor, you get your diagnosis, you go on a salt restriction diet, you may be put on blood pressure medications, diuretics to relieve the fluid volume in your body. If that doesn't work, they may inject prednisone into your inner ear if that doesn't work. then you may be looking at steroids, or you may be looking at going to have your inner ear vestibular nerve ablated. And having worked with a lot of Meniere's patients, it is not a fun condition, and I wish there was more awareness about it, because if most people knew the suffering that a Meniere's patient goes through, I think people would have a lot more empathy for it. But anyways, not that there's lack of empathy, but it is a very serious condition. So with all that being said, MRI imaging is becoming important in the differentiation of Meniere's disease versus vestibular migraines, and researchers are looking at that because they can literally see, in my diagram here, the inner ear that I commonly reference. Your inner ear, as you can see here, has fluid inside of it called endolymph, and the thought process is that endolymph swells in Meniere's patients, and that the endolymphatic sac, which is like a duct that drains the inner ear, somehow is clogged or not able to adequately drain the inner ear. There are many different theories, but this is the main one that's talked about. Just as though if you ate Thanksgiving dinner and your abdomen is going to distend, they say the same thing about the vestibular labyrinth, really, and the cochlea, and that when there's too much endolymph, basically the inner ear will swell, it will distend, and that results in what's called endolymphatic hydrops. So on these MRI images, with 3T MRI imaging with contrast, researchers are now able to say, oh, we actually see the swelling. And we can see the swelling, and this tells us that this person definitely has Meniere's. Because the other problem I've seen in clinical practice, and there are other doctors saying this too, is that there seems to be maybe our Meniere's patients being overdiagnosed. And so if you feel like you've been overdiagnosed, or that you're really questioning if you have Meniere's disease, I would then talk to your doctor and ask them, say, hey, can I get a 3T gadolinium enhanced MRI? That may be available in your area. It may not, but it's worth a discussion, because this is now becoming one of the gold standard diagnostic tests to really substantiate if somebody has Meniere's disease. Before this imaging technology became available, in essence, Meniere's, in terms of a histopathological diagnosis, had to be done post-mortem. So like after somebody died, they'd have to go in and look at their inner ear to observe for the signs of the hydrops. Now with 3T MRI imaging, we can say yes or no. So that's what these articles are about. As we go down, I just like to throw these articles in so that patients can kind of get an idea of what I'm looking at when I'm talking about these things. And this is a great article out of the Journal of Neurology 2014, where they looked exactly at the endolymphatic space size. So again, as I mentioned, the fluid in your vestibular system and your cochlea, this is where you hear, this is your balance mechanism. The fluid within there is called endolymph. So they're looking at the endolymphatic space size in Meniere's patients versus vestibular migraines. And the net sum of it, and they go into everything I just talked about, and that there's a lot of overlap between the two conditions. You even have something called cochlear Meniere's, where individuals will have fluctuating hearing loss and tinnitus, but they won't have vertigo. Then you also have vestibular Meniere's, where individuals won't have hearing loss, but they have vertigo, episodic vertigo. And vestibular Meniere's really overlaps a lot with vestibular migraine. So they're saying, hey, we need a better way to differentiate these two conditions. And here, if you want to pause the video, you can read through the diagnostic criteria for basically definite Meniere's disease, probable Meniere's disease, possible Meniere's disease. Maybe you'll be able to identify where you're at on that spectrum. And then here you have the criteria for vestibular migraine. In essence, vestibular migraines are what I described. Lots of times these are individuals who have a history of migraines, but now they have these nebulous headaches, and these headaches then can be associated with episodic vertigo about half the time. They have light and sound sensitivity. They may or may not vomit, but they can have vertigo or the rocking and bobbing sensations, which then confuses them with Maladie-Barkman syndrome, or doesn't confuse, but it raises a question, is it MDDS, which are individuals who come off cruise ships and are dizzy, or if it's vestibular migraines. Go back and watch my presentation from the last couple weeks on that. And here you can see these little black spaces. This is a 3T MRI where the researchers are showing this is what endolymphatic hydrops looks like. This is what the inner ear should look like without it. So think of distension, think of bulging. That's what we're seeing in these black spaces representing endolymphatic hydrops in a Meniere's patient. And I really like this diagram. This diagram really represents it well. The overlap between vestibular migraine and Meniere's, vestibular Meniere's disease really seems to be in this overlap area. Cochlear Meniere's is not. And again, using 3T MRI imaging is becoming the way to differentiate these two, because vestibular migraine patients can have abnormalities on the video nystagmography testing, where the goggles, where they put those on you and they inject warm and cold air into your ears. They can have findings there. They can have signs of sensory neural hearing loss, low tone, very similar to Meniere's patients. So that's a great differentiating feature. So enough on the imaging. I'm going to scroll through these. Now, Hashimoto's thyroiditis and vestibular dysfunction. What is Hashimoto's? Hashimoto's is where the immune system attacks the thyroid gland. Many of you have had your thyroid tested. And if your thyroid's been tested and you're normal, then that's great. But there are differences here. So there's thyroid hormones and then there's autoimmune responses to the thyroid. If somebody has a low thyroid, they have a very high probability of having an autoimmune response to the thyroid. But individuals can have normal thyroid hormones and have this immune response against the thyroid. The immune response, irregardless of somebody having low thyroid or normal thyroid function, the immune response is called Hashimoto's Thyroiditis, after Dr. Hashimoto Hakuru first identified the condition in 1904. So Hashimoto's thyroiditis has been observed to associate with Meniere's disease, and this is what this article is all about. I believe this was published in 2017. Dr. Chiarella is the lead author. She does a lot of studies on endocrine function and vestibular disorders. Needless to say, as you can see when I bring my cursor right here, 38% of Meniere's patients in this one article were found to have Hashimoto's thyroiditis. It's a pretty big deal. And then in another article looking at either Hashimoto's thyroiditis or non-specific organ autoimmunity, meaning these individuals had signs that their immune system was attacking their body, but they didn't have a specific diagnosis. When you lump all that together between Hashimoto's and non-specific autoimmunity, 60% of Meniere's patients had that. So over half of Meniere's patients had these signs of thyroid autoimmunity or nebulous autoimmunity. That's really important. And so it's thought that maybe the autoimmunity is leading to the endolymph not draining as well from the inner ear, and as a consequence, the swelling of the inner ear. So that's that. I didn't attach the article, but in 2012 out of the journal Laryngoscope, if I remember correctly, 57% of Meniere's patients were found to have gluten allergies, not gluten intolerances, but just gluten allergies, which is pretty striking, because typically more people have gluten intolerances than gluten allergies. So gluten is the protein in wheat, barley, oats, and rye. And so again, around 57%, 60%, you see these statistics where over half of Meniere's patients seem to have this allergic or autoimmune issue going on. So what does this mean to you as the Meniere's patient? Bring this up to your doctor and say, hey, I want to be checked for Hashimoto's, not just my thyroid. I want to be checked for Hashimoto's. Check my thyroid antibodies. Maybe they come back normal, maybe they come back positive. But at least that way you have some information on this. And you can also talk to your doctor, your nose and throat specialist, and say, hey, can you check me for my anti-nuclear antibody? Can you check me for my PANCA antibody, or just say ANCA antibody? Ask for those antibodies to be checked and see, do they show up or not? Again, you're not my patient. I'm not telling you what to do, but if you have curiosity about this, those are the tests that you can talk to your doctor about. And then this is a great study out of Korea. where they looked at 1.1 million patients from a national database. And they, in essence, found a large relationship between vitiligo, which is the skin condition where individuals will have depigmentation on their skin, and Meniere's disease. And they saw a significant relationship, particularly in the younger cohort. I believe they also saw a relationship between allergies. Allergies have been talked about extensively with Meniere's patients. So the net sum is that it seems like maybe this autoimmune allergic inflammation in the body is leading to the endolymph from the inner ear not draining as well as we want it to. And is that the cause of the inner ear swelling, distending, resulting in endolymphatic hydrops, which is what we're seeing on MRI images? And when that happens, that might be the source for you having episodes of pressure and tinnitus and vertigo with vomiting. So that's the story. So I like to bring up these topics because it's fuel for thought, it's fuel for discussion. If you have any questions, go ahead and send them to us. That info@gatesbrainhealth.com is the best email address to reach us at, or you can post it on YouTube. But yeah, I've been talking about this for a while, but I just wanted to bring the research articles in so you can see them for your own self. You can go pause the YouTube presentation, go find the articles, look at them, and let us know what you think. Again, I'm not saying 100% this is the cause of Meniere's, this being autoimmune and Hashimoto's, but I am saying there is a strong association that needs to be looked at, and we work with patients dietarily. You can go back and watch my thyroid broadcast. Hashimoto's ties in heavily with the foods that we eat and our gut microbiome, our gut bacteria. Again, I mentioned gluten. So I've worked with Meniere's patients with their diets and also looking at histamine responses and things like that. So that's what I do. But the main thing is I want this information to get out there about these relationships between Hashimoto's and autoimmunity and Meniere's disease. So thanks for watching. I hope you all have a great day, and we will see you later.